What is this, schizophrenia? Where is it located,
Yes. Yes. If you look at the causes, one of the first things we look at is genetics. So many people ask, does it run in families? Instead of saying, I would rephrase that, instead of saying run in families, maybe a minority could be familial. That is where there is genetic mutation. Genes cause some changes. What happens, it could be subtle things. Like I said, information processing can be different in people with schizophrenia who have these genetic changes. And because of these genetic changes, we have other things like what we say neurogenesis. The fundamental unit of the brain is called neuron. You have to see on a microscope.
Yes.
The number of neurons that are developed or the connections in between the neuron. The way the brain functions for all of us, I'm talking so much now, the way the brain functions is all these neurons kind of talk to each other by release of chemicals, what we call neurotransmitter. You may have heard of dopamine, you may have heard of GABA, glutamate. So when these genetic changes happen, subtle deficits happen in the release of these or the way the messages are passed amongst the neuron and in the number of neurons. We know that people with schizophrenia, their brain volumes are a bit lesser than other people of the same age. About
the size of the brain, you're saying?
Yes.
Okay.
What we say is 2% reduction we have seen in various studies. And that is important because you may have seen the brain has gray bits and white bits. And schizophrenia affects the gray volume as well. 2% reduction is what you can see. So speed of processing, understanding, all of these can be impacted when you look at the number of genes involved. But that's not enough to cause the syndrome of psychosis. As I said, they may cause subtle deficits as years go by. The next important thing after genes would be what we call developmental factors. Things going wrong in pregnancy, too much alcohol, for example, too many drugs, or some infections, or anything that goes wrong in the pregnancy, any insult to the baby's brain, that could happen. So it's all a combination of these factors that could eventually cause the psychosis. Genetic factors alone are important in some people. For example, twin studies are done, wherein if they are identical twins, where they look exactly the same, they're more likely, if one twin has it, then the other twin is likely to get it by 80%.
Okay.
80% chances are there. Let's say they are non-identical, they don't look the same, then...
Which means the twins are born out of two different cells of the mother.
Okay. Yes.
Okay.
So then the increased risk drops down to 10%.
Okay.
Let's say we have a parent, many studies are done, we have a parent with schizophrenia, then it is more likely that their child has a 10% excessive risk compared to the rest of the population.
Okay.
So it goes up like that. So one is genetic risk factors. Only when there's a mutation, when we say mutation, there's a change in the way the gene expresses the protein, then it's a much higher chance than all this put together. It's certain that they will develop schizophrenia, and that's very rare in some syndromes. We'll leave that aside. But what I'm saying is the genes are important, but that's not the entire story. We also look at the developmental issues like the womb, factors to do with the womb, and then early insults to the brain, especially in the early formative years, what we call environmental factors. It could be things like, deprived areas, growing up in socially deprived areas, economical deprivation, lack of access to basic things like hygiene, nutrition. All of these also can actually add to these risk factors of genes, the developmental history. The environment is important. And also the other things, social things, like social factors, like how do parents interact within the house? How do families interact? Do they just shout at each other?
Okay.
Do they know how to cope? Do they know how to solve problems? Or do they just blame each other? Is that the pattern that the children are seeing? This is what we call high EE, high expressed emotions in the family. These are all some of the risk factors. So genes is one part of the story. Developmental insults and then the environment in which they are growing up in. Let us say somebody is not having a good combination of any of these, they are extremely likely to develop schizophrenia.
So it's not just one reason that it happens. There are multiple
Yes.
factors which
That
influence
come
together and causes.
Yes.
So while talking about schizophrenia, the reasons why this schizophrenia happens and what are the reasons for this illness, what causes this schizophrenia, you were talking about the genes being one of those important reasons, plus also the environment, the where the person is born, and I think including the social context also you brought in, which all can have an influence and probably trigger the development of this severe mental illness. Is there a part of the brain that you can point fingers at and say that this part of the brain is affected and this is schizophrenia?
Okay, so it would be difficult to pinpoint just one part of the brain and say this is the area, because what we have seen in all the studies is some different interconnected areas of the brain are affected. When I say interconnected, these are different spots on the brain, different areas which carry out similar functions, but it is like a network. They all kind of help each other in carrying out a particular function. So what we are seeing, as I told you, we have first genetic changes. They cause these microcellular changes in the brain, and then they kind of manifest as slight information processing, cognitive deficits. Then when insults happen because of environment development, then the full-blown illness happens. So if you look at the areas then of the brain, research studies have revealed that there's deficits in these different circuitry in the brain. When I say circuits, there are connected areas in the brain which perform a particular function. These are what we call pathways. They are all connected with each other by different, what we call the fundamental unit, by the neurons. And they all communicate with each other by those chemicals, that is the neurotransmitter. So when you look at schizophrenia, some of the main chemicals, neurotransmitters that are affected are, you would have heard of dopamine, GABA, serotonin, glutamate. These are all involved. But the final thing is they are
chemicals of the brain.
Yeah, they are what we call chemicals or neurotransmitters. And
Neurotransmitters.
And they all finally affect the GABA pathway. So there are some structures in the brain called mesolimbic pathway. There's something called the striatal pathway. These are specifically some of the areas that are affected. And also this area, what we call the prefrontal cortex. Remember I told you about cognition. This prefrontal cortex is very important for cognition. It is important for all this higher processing, higher functions. And that area is also affected in addition to the mesolimbic and the mesostriatal pathways. What we call the mesolimbic pathways, they are generally responsible for the positive symptoms. Okay, because the dopamine secretion has gone up there significantly in these areas.
That is why he is very
psychotic, angry, aggressive, seeing things, hearing voices, having bizarre beliefs, all of this.
Okay.
And then there's the mesostriatal pathway also in the brain, which also connects here to the PFC, what we call prefrontal cortex.
Okay.
And that is involved more in what we call the negative symptoms. Okay. And it is there because the dopamine is kind of reduced in that pathway. So one side we are having a bit excess, one side we are having a bit less. So the medicines which we have also accordingly affect these pathways. In these pathways, mainly the newer medicines that we have, what we call second generation antipsychotics, they all affect some of the other chemicals too, like serotonin, what I say. There are different areas, and within the same chemical, there are, many subdivisions we call receptors, 5-HT21A, B, C receptors. So they all affect these different chemical areas.
In the brain, both the areas of the brain, I think you are talking about the prefrontal and different deeper areas of the brains that is affected. Along with that, there is also the chemicals of the brain, which is
Yes.
also kind of
Yes.
disturbed. So,
Yes.
is it a combination of this, or how do we?
It's a combination. So, like I said, the function of the brain is tied to its structure. So, where you have structural deficits, you also have the function is carried out by these chemicals. So, there is a problem there also. So, we have a structural deficit. We also have a functional deficit, and the two are kind of underpinned by genetic deficits, which cause cellular problems. So, this is how symptoms develop. Medicines will target both these pathways. As I said, in one end, you want dopamine to go down, so psychosis goes down. And then in the other end, when negative symptoms are there, you want dopamine to come up. So they are much more kind of motivated and they can do things. That is what we are trying to achieve. But like I said, there's other chemicals too. And medicines are based around them also.
Great. So, there are areas of the brain which we know has problem or affected because of which the person develops these problems. Then you are mentioning about the genetic factors and the areas of the brain being affected right now. You also said that environment, the social circumstances can also have impact or trigger this. So, if somebody has a failure in life, or he fails in his exams, or he has got he's separated from his partner for whatever reason, and he's going through he has lost somebody, which is a painful thing for anybody going through. Per se, just these instances, can they trigger schizophrenia?
Yeah.
Or should they have problem?
Absolutely. So because we all go through all of these problems, we all have stressors in some or the other way, be it financial or life stressors, daily stressors. We all don't develop schizophrenia. So when people have stressors, and it is only those people who have these underlying brain deficits, when those deficits interact with these stressors, that is when the full psychotic symptom kind of gets blown up, and that's when you see the episode. So not everybody who has stressors gets schizophrenia, and not everyone who has only gene changes gets schizophrenia. It's a combination. It's nature and nurture put together.
Interesting.
It's a coming together of all of these things.
Interesting. This might be little, socially controversial question, and you can choose to, not answer as well. If there is a family history, or there is a family member who has got schizophrenia, and I'm marrying a person whose father, mother, or brother has schizophrenia.
Yeah.
Can I? Should I?
It depends. So the risk will go up. You need to be aware that the risk is going to go up.
Okay.
As I said, if a parent has, then the child is more like the child's risk of developing it goes up 10%. So you need to bear that in mind. And we are still not, genetic testing is something that comes to mind here, but we are not at a stage where we are exactly able to predict as yet that which person will get and they will not get, because our studies are still not as advanced. I hope in the future we get studies wherein we are able to do genetic studies and say it's extremely likely that this person will get. We have genetic testing available for some other conditions, but for schizophrenia on a routine clinical basis, we are still not able to use it. So it's a matter of judgment, how comfortable you feel, what is the level of social support in that family. If you're going to maybe marry somebody, how well do you know that person? What's the overall social support? These things then become important.
What happens when somebody has schizophrenia? They just take medication and get well, or what is the natural course of this illness?
Yeah. So it depends on what's the diagnosis. So if it is just if it's only schizophrenia, because many people will have other what we call comorbid conditions. Like some people will have, alongside schizophrenia, they may have drug-induced psychosis running. Some people may have comorbid anxiety or depressive illness, or some people will have another serious mental illness, what we call bipolar disorder.
Okay.
So the future course of the condition also depends on what other things that the patient is having. And the other thing that matters, if you look at schizophrenia alone, roughly I think it's reasonable to say a third of them go on to recover. Uh, they become pretty well, they come to functional levels, if not to the level of normal population, reasonably functional. Because stress often triggers the condition. You don't want them to be doing too many stressful things like a job that is way too intense. That is something they need to cut down. But I don't see why a person with schizophrenia, right treatment, right therapy, be it medication and therapy, why they cannot return to normal levels of to normal living.
So you said about one
Third of them can return to that with treatment, of course, and I emphasize treatment. A third of them go on to have what we call relapsing and remitting course. That's relapse symptoms from time to time. They are staying well in between. This is something which we see with many conditions like diabetes, hypertension.
Yes.
Many of them go on to do well. Then there are periods for some of them wherein they are up and down in their sugar levels. But then there are some of them with schizophrenia, another third maybe, who do not respond to treatment and they remain impaired. We could roughly kind of chop it up like that. But treatment is very important to manage each category.
Does this course of illness differ if we are able to recognize it early, treat them early?
Yes. It makes a big difference because treatment response is very important. There is something called first episode psychosis. There is something called duration of untreated psychosis. These concepts are very important, and it's important to maybe try and pick up these symptoms as early as possible, because if you institute treatment earlier, there is a lot of evidence to say that response rates, outcomes are much better than if you leave the symptoms lingering for a long period of time. They become much more entrenched and less responsive to medication. And similarly, when people discontinue medication, we find that relapse rates are much higher in those people, and it's much more severe. The symptoms of relapse are more severe. They take longer to respond. So it's very important to identify, treat, respond, and stay in treatment.
So earlier intervention certainly helps people, and they need not get into that last 1/3, unfortunately, who suffer.
Yes, a lot of our people unfortunately come a bit late, as I said. Negative symptoms may have lingered for a very long time before they realize. So awareness is key. And then there are many people, particularly from the rural side, if you like, who don't come to the attention of psychiatrists, or who don't seek help earlier because they attribute it to other cultural factors. As you know, they think they are possessed, or there is black magic. Even as a culture, as a society, we believe that black magic is going on. We do all the temple trips, pilgrimages, but then we also need to, all that is fine, but we also need to seek treatment, because as we spoke, there are genetic changes, cellular changes, there are things happening in the brain which needs to be addressed.
So this brings me to this most important part of our conversation about the treatment for this complex problem. It is not like a fever or a cough and cold where you go to a doctor and take the medicines and 3 days or 5 days you're out of it. As I understand, there is a genetic component which is beyond any treatment. Second, there are, I was talking about the environmental components, where the way he is brought up, the stressors of the life, or the challenges that he has gone through. So does treatment take into consideration all of it? When you say treatment, what all you do? I mean, how do you? Well, it's as complicated, as diverse as the challenge is.
Yeah. So once we diagnose that it's a schizophrenia and not anything else, as I said, very important to rule out drug-induced psychosis.
Yes.
Once we have kind of clarified that, the mainstay of treatment is medicine, of course, because we need to set right the chemical imbalance that has been happening.
Dopamine and other things that you
mentioned. And serotonin pathways, both the pathways. So mainstay of treatment is medication and what we call antipsychotic medication. That will be the mainstay of drugs.
Antipsychotic.
Yes, they prevent psychosis or they are against psychosis.
Okay.
So there's a whole range of drugs. In that we have different categories. We have some older drugs we call first generation. We have some relatively newer drugs we call atypicals or second generation. In terms of efficacy, what we say in terms of their ability to reduce psychosis, they are largely similar. But what makes a difference between these two groups is the side effects. So we'll come to that later. But the mainstay of treatment, as I said, is medication. We need antipsychotic. In addition to that, if they have other issues like sleep issues because they are not sleeping very well as part of the symptoms, we can give them symptomatic treatment, like give them a bit of sleep medicine for a short duration of time. If they have in between, if they have some depressive symptoms, we might want to treat that. But the mainstay will actually be our antipsychotic medication. They are not addictive. What they help in reducing psychotic symptoms, they are a bit less effective. I must say, it's a bit sad to say, they are a bit less effective for negative symptoms.
Okay.
Most of our antipsychotics, they work well for positive symptoms. And amongst the antipsychotics, there is a drug called clozapine, which has most efficacy compared to the rest of them. But we still reserve it for the very end. But anyway, those drugs are available. They reduce symptoms. So the idea is they also improve quality of life. They bring back a level of stability, recovery. So patients can go on to have a more normal life and reintegrate into society.
So one is about the medicines part that you've mentioned. What else what else is helpful and what else should we do as treatment?
Yeah, the other most important aspect of treatment is obviously psychological, what we say is talking treatments. But even before talking treatments, psychologists are, as a team, they are very helpful in helping us diagnose the condition.
Talking treatment, in the sense, you talk to the patient and help them.
Talk to the treatment. But before we get there, the role of psychologists is very important because we all have to work finally as a team. Psychiatrists, psychologists, social workers, nurses, counselors, and of course management. We all have to work as a team in order to ensure that the individual is on the right path. So psychologists, they also help us in helping to confirm the diagnosis. They do various psychological tests which we all interpret in context. The psychological blood test, investigation, history, everything has to be interpreted in context. So psychologists are helpful that way. And in terms of therapy for schizophrenia, CBT is one of the types of talking therapy. It is short for cognitive behavioral therapy. It helps us to understand, it helps us to think differently. The way CBT helps us, it changes our way of thinking so we feel better because there's a lot of distress associated. So CBT also has some evidence alongside medication. And there's something called behavioral management because a lot of people have negative symptoms, be it in terms of lack of motivation, lack of interest in things, or lack of ability to socialize. Behavioral treatments are very important in order to mobilize these people so they get to do things. So rehabilitation is a very, very important part of overall treatment. So we have pharmacology, which is medication. We have psychology. We have behavioral treatments as well. In addition, there are newer treatments, there are newer drugs, and then there are some newer treatments, what we call user neuromodulators, but there are things like RTMS, but these things still need a bit. So RTMS is short for repetitive transcranial magnetic stimulation. It's a particular type of what we call physical treatment. It does not involve tablets. It's a physical treatment wherein we keep two magnetic coils over the head and it generates small electric currents. So it brings about chemical changes inside. It is completely painless. You don't need blood tests or anything. But the evidence for schizophrenia, RTMS and schizophrenia, we still need a bit more evidence, but it is certainly there as an option. And the other thing, important treatment when it comes to neuromodulation is ECT.
ECT?
Yes, you may have heard of ECT, short for electroconvulsive therapy. Previously used to be called shock treatment.
Okay.
And You may have seen in TV, people may have seen in TV how ECT used to be delivered in those ages, but it's quite modernized now. It's not as scary as it used to be. And as you know, ECT involves putting people to sleep for short durations under general anesthesia, giving them small amounts of current that passes through the brain, and that induces seizure. When that induces seizure, it makes
Seizures in this fits.
fits.
Okay.
And that helps the medicines to work better. Symptoms also come down. But that is reserved for extremely severe or severe cases, or where there is what we call severe suicidality, or there's something called catatonia as part of schizophrenia. That's a particular symptom. When it is very severe, we resort to ECT. Otherwise, the mainstay will actually be medication, therapy is what, and
So
behavior.
can these treatments be done staying at home, or I should get admitted, or I should
So it depends on the stage of illness, the severity of symptoms, the level of distress it is causing to the patient, the level of risk, and also distress and risk to the extended family and public in general. So it depends on all of this. So if the symptoms are mild, manageable, or let us say people have already been diagnosed, families know how to manage, and they are pretty stable, they can stay at home. But if it's a first episode psychosis, more often than not, we would advise admission, mainly because we still don't know the risk as yet. And if families are apprehensive especially, it is better to get admitted.
Okay. So not necessary that because we call it as a serious mental illness, not necessary that everybody has to get
Admitted all the time, no.
So it's depending upon the person's need and what he's going through, different forms of treatments and different settings of the treatment are recommended by the treating psychiatrist. You have worked in India, you have worked in UK as well. So if a person with schizophrenia comes to you, in UK, if a person with schizophrenia comes to you in India, would you treat it differently, or?
See, how the treatment is delivered might slightly differ, because as I said...
What do you mean when you say how the treatment is delivered?
See, finally, giving the medicine will be the same.
Okay.
The pharmacological management is the same. It is how the medicine reaches the person might differ. As what I'm trying to say is much more resourced, they're well-resourced, they have multiple teams. They have something called the community mental health team, wherein patients are looked after in the community. That is when they are in their own homes. They have separate inpatient services. Many of the hospitals trust. So teams might be different. And then there's the emergency service teams, which might actually acute mental health crisis teams, which might end up treating these patients. So how a patient reaches the doctor might vary a little bit depending on which team picks them up or what's the policy protocol in each trust. But the end story is always the same. Same mode of assessment. They will need to go through blood tests, if need be brain scans. Medication will be the same, irrespective of where they are in.
Is this a new problem that we are seeing, schizophrenia, or is it a old one? And if it is very old, have we progressed enough in terms of our understanding and in terms of the medication? And are there anything newer ones that is coming up that you see which can be helpful, or people who are suffering with schizophrenia can be hopeful?
Yeah, so schizophrenia obviously has probably been around for centuries now. But what, most recent times, I think it It was first initially coined as dementia precox in early 1900s, 1912, by someone called Kreplin. And from thereafter, I think our understanding has grown leaps and bounds. Our first drug used for schizophrenia was chlorpromazine in the 1950s. And then fast forward, we had...
That is given for vomiting or giddiness.
Yes, and it also, then they incidentally found out it works as an antipsychotic. Then we had many other first generation, as I said, antipsychotics, and second generation, followed by atypical or second generation. You may have heard the names olanzapine, risperidone, alisalpride.
Lot of them, okay.
Aripiprazole is one of the relatively newer ones, paliperidone, etc. Some as tablets, some as injections. You know that. Now, most recent, and they all act on, there's two groups because they act on different chemicals. Now we have a third one. You may have heard of Cobenfy.
Okay.
That's actually approved by FDA last year. And that is approved as a treatment for schizophrenia. It is approved mainly because it is supposed to improve the positive symptoms, impacts negative symptoms as well, but also with less side effects. The issue which we have with the current antipsychotics is, okay, they help to an extent with positive symptoms, not as well. Some of them help with negative symptoms, the newer ones like cariprazine, a bit of amisulpride, clozapine, but side effects are there in all these drugs. And one of the main role of psychiatrists is to balance effects, side effects. So that is where a lot of monitoring, blood tests again, ECG, echo, and all these tests come in. But the newer drug is supposed to have much less of these side effects and is supposed to be more effective. So that's why everyone's excited about it. And it acts on completely different neurochemicals, on completely different neurotransmitters called the muscarinic system.
Okay.
So side effects are not zero, they are still there, but supposed to be much more manageable, and it is more to do with a little bit of nausea, vomiting, which we have with most other drugs anyway. So that's why there's a lot of hype, and I think the future also is looking at this group, the group of drugs which will work on these set of neurotransmitters and receptors, if you like. So that's where
it's not that pessimistic, the scenario is?
No, not at all. And they are looking at so many other drugs. They are looking at inflammation in the brain. They are trying to see if those kind of drugs will help. But Cobenfy is something that's already been approved. It's up and running in the US. So I really hope it comes to India,
A lot of shortly. Yes. Lot of positive things and hope that even if somebody is diagnosed with this kind of a serious illness, they need not worry. Yes. There are a lot of treatment options that can help. In our own country, I'm not aware of the UK, but in our own country, we have different systems of medicines. Mm-hmm. Okay. Whether we call allopathy or modern medicine system, and our own Indian system of medicine, Ayurveda, homeopathy system is there, the naturopathy system is there. So there are so many systems of medicines, and I think Unani is something which I have heard of, and in India we bracket all of them under Ayush, group of systems of medicines that we practice. As a patient with schizophrenia, should I come only to you, or can I go and explore, any of these Ayush systems and, take treatment there?
Yeah, so this is very much similar to what's happening in other specialties as well.
Okay.
So options are available. Be it with Ayurveda or allopathy or with homeopathy. The reason people go doctor shopping is because options are available. Societal, cultural attitudes are also very important, because a lot of our people would like to believe in Ayurveda, considering that it has originated from this country. So there is a lot of belief in that. Having said that, and if they want to go into Ayurveda, I would not be completely against it. That is left to the individual discretion of the patient and their families. But what I would certainly not recommend is, one, mixing the drugs. Mixing Ayurveda with allopathy is a big no. one of the main reasons for
Why do you say that?
is drug interactions.
Okay.
We don't know how these drugs will how the drugs will interact with others, with the other groups, and what kind of reactions you'll have in the body. What if the liver goes for a toss? We have seen many patients who have taken many of these drugs, and then they come with deranged liver functions. So what we would certainly advise is do not mix the different specialties. You want to do doctor shopping, you want to do the different specialties, okay, go. But what I would also like to say, I don't know much about the other specialties, but certainly from an allopathic viewpoint, I would like to say it's very scientific. It is very evidence-based. We are still accumulating. I would like to say we are still accumulating evidence. We don't have all the answers, but we at least know that we don't know the answers, and we are working on that. And a lot of these genetic studies, molecular studies are actually happening. So it's based on all of these. So I feel much more confident if my patient was treated under the allopathic system rather than the other systems, because although they want to try all the other systems and they come here too late, we are not able to effectively treat them as much as I would like, because precious time is lost. So I would encourage people to get all the information and then make an informed decision, and then, choose a treatment that they deem best.
Great. So there is no harm in exploring other systems of medicines that is available, but it is.
Yes. In my view, it is better if they come allopathy way quicker, because we know what works, we know what doesn't work, we know what effects are there, we also know what side effects are there. As opposed to saying there are no side effects, it's natural. We at least know what the side effects are, because studies are done, papers are published, not just in India, all over the world. And even when they do the studies and they publish papers, it is much more organized. Not all papers will be accepted. There's systematic methods of doing scientific studies and arriving at that conclusion, which is why I say evidence.
Understanding of schizophrenia
Very clear.
and the treatment options and the evidence for those treatments are probably much more organized in one particular system of medicine.
Yeah.
So it's a choice of the patient at the end of it. But in our own country, because of availability of different systems, it's certainly the choice that.
Yeah, and it's very important that in order to preserve Ayurveda, this kind of a thinking actually comes about, and people who are pursuing Ayurveda, I mean the faculty clinicians, will also need to look at evidence, and if it's not happening already, if it's happening, fantastic. But
I think one of the series of our Kadabam's Insights, this podcast, I would like to certainly host with one of the other specialities and other Ayush systems of medicine, so that we get to know what is their perspective,
Yes.
how do they see, and what is the evidence and what kind of treatment options they have. So we are almost at the end of our conversation. This is probably we can call it as a rapid fire, but it is not as rapid as it can be. The expectation here is we would like you to give a short answer, or maybe yes or no kind of a thing. These are certain myths that is there around schizophrenia. So shorter version so people can get a quick answer. So we hope it helps them. Are people with schizophrenia dangerous?
no, not always.
Are people with schizophrenia angry, hurt others, aggressive?
Rarely.
Can a person with schizophrenia marry?
Oh, that's a difficult one. I suppose they could marry if the opposite party, the spouse side, they know about the illness and they know what it entails, and everyone is agreeable. Why not?
They can.
But if not, it may not be such a good idea. If everyone is involved, if they don't know about the illness, then it may not go down very well once it's found out. We have seen a lot of divorce cases, etc., separation cases.
Can they get into normal jobs? Can they lead a normal life?
As much as possible, yes.
And can I live without medicines?
Unlikely. You will need medication for a very long time.
Thank you so much.
Thank you.